Okay, mamas, let's get right into perinatal nutrition, okay? What you eat during your pregnancy makes the most impact on your pregnancy, okay? It's going to determine whether you have a healthy pregnancy versus an unhealthy pregnancy, a normal pregnancy versus a complicated pregnancy. Now, we can't control everything that goes on during your pregnancy, but the things that we can control, such as what you are eating, is key. And that's something that should be paid most attention to. Because I know that we love our sugar, we love our quick spots where we go pull up at the drive-through, pick up our favorite takeout. That's not always the best option, the best thing to do when you're pregnant, okay? We want to make sure that you're eating as clean as possible and you're eating the most well-balanced diet that you possibly can be eating. Meaning lots of beans and greens and clean meats if you eat meat. Salmon, which is a nice lean fish that gives you loads of omega-3s, which we'll get into. And to try to stay away from things such as caffeine, alcohol, sugar. You know, those are foods that we want to stay away from because they can cause us some harm. All right. Eating a balanced diet during your pregnancy can help you to prevent hypertension, which is also called high blood pressure. Gestational diabetes. It can help you to prevent excessive weight gain and also lower your risk for preterm labor. So as a midwife, all of my clients hear me talk about protein the most, okay? Protein is what actually builds your baby. It grows your baby, okay? And it also helps to increase the integrity and build the integrity of your vaginal tissue so that you're not tearing when you give birth, all right? So protein is probably one of the most important nutrients that you need during pregnancy. Food sources for protein include meats, clean meats, lean meats like chicken, fish, turkey, beef, okay? There are several other sources of protein, lots of other sources of protein, especially for our mamas who don't eat meat, okay? Which we'll get into a little later. But protein is number one on our list. So let's talk about iron, okay? Iron is another vital nutrient we need to be paying attention to. When a woman is pregnant, her blood volume in her body doubles in amount, okay? And in turn, that can cause a dilution of red blood cells, which makes her anemic. And anytime that we have a state of anemia in mommy, we are compromising the blood flow and oxygenation to our baby. Symptoms of anemia in mothers can include fatigue and weakness, yellowing of the whites of her eyes, cold feet, cold hands, and in more severe cases, shortness of breath. Vitamin D rich foods include eggs, fish, avocado, and sweet potatoes. Foods rich in omegas and B vitamins include avocado, almonds, salmon, and chickpeas. So calcium is our last basic nutrient we're going to talk about, okay? Calcium helps your baby's bone development, all right? But here's another really interesting fact about calcium in pregnancy. Research shows us that women who go into spontaneous labor have higher levels of calcium, okay? So our goal is not to have to be induced or be scheduled for a cesarean, right? So we want to make sure we're getting the calcium that we need during pregnancy to increase our chances for spontaneous labor. 1,000 milligrams per day is your recommended dose. And foods rich in calcium include citrus foods, citrus fruits, green leafy vegetables, and dairy. So let's talk about foods to avoid. And the first thing we're going to talk about is sugar. All right. Excessive sugar is never a good idea during pregnancy. So those cravings that you have for ice cream and candy bars is something that you really have to curb and replace with a healthy alternative. All right. We know that excessive sugar can put you at risk for gestational diabetes and excessive weight gain, but it can also put your baby at risk for excessive growth. It can put your baby at risk for hyperactive behavioral disorders. And also it can cause your baby as a toddler and beyond to crave sugars. Okay. So because we know that sugar is addictive, we want to make sure that we're staying away from sugar as much as we possibly can. Quickly about processed foods, let's talk about it. What is a processed food? A processed food is anything that you grab out of the store that comes in a box that comes out the freezer, that comes out of any plastic, okay? That is all processed. I don't care if it says vegetarian, organic, okay? It is a processed food. We want to make sure that we are cooking as much as we possibly can at home. Fresh foods, fresh meats, fresh vegetables, okay, as much as possible. Because we know that processed foods, anything in a freezer, in a box, or in plastic, has additives and preservatives to keep the shelf life, right? And that is what can cause toxins and things to reach your baby and cause other issues, okay? So we want to make sure that you are paying attention to that when you're going grocery shopping, okay? Okay, and caffeine and alcohol. Let's talk about it. Caffeine and alcohol are two substances that you guys want to stay away from as well as much as possible. Research doesn't tell us a safe amount of caffeine to have during your pregnancy. However, we know that excessive caffeine intake can cause a low birth weight baby and can have some issues, can also cause issues with cardiac activity, okay, your baby's heart, and irregular heartbeats and arrhythmias and things like that, okay? We also know that excessive alcohol intake and nicotine intake can also cause issues for our baby as far as low birth weight. And also during pregnancy can cause some prenatal complications as well. So you want to make sure you're staying away from those things too. A special note to my vegan and vegetarian mamas, all right? Because your diet does not include meats or dairy products, you are commonly faced with iron deficiency, which can lead into moderate anemia for you, and also protein deficiency, protein intake deficiency, right? Which can lead to having a smaller birth weight baby, okay? So these are things you want to be very attentive to when you follow these specific diets so that you can make sure you're getting what you need and what's recommended to maintain a healthy pregnancy as well. Perinatal fitness has many benefits, okay? It can help regulate your blood pressures and blood sugars. It can help you to maintain a healthy weight during your pregnancy. And it can also lift mood, okay, and make you feel better overall, okay? Pregnancy comes with many ailments, so exercising can be something to help to make you feel a little better. Relieving constipation, all right? Moving your body and at regular intervals, all right, helps you to also train for the marathon of labor. And I say that because labor is definitely that. It is a marathon. We don't know if labor is going to go fast or slow for you, but conditioning during your pregnancy in preparation for labor and birth for you is very, very beneficial. Okay, so let's keep that in mind, that labor is a marathon and you're training for this event. Okay, mama, so let's talk about exercises that are considered safe, okay? First of all, if you have been told that you are high risk or that exercise is not a good idea for you, please listen to that advice of your practitioner or provider. If they have specifically told you not to exercise, please follow that recommendation, okay? But if you are a mama who is carrying a normal pregnancy and have no issues or risk factors, then walking is probably the best thing that you can probably do for yourself during pregnancy. It's the most efficient exercise. It's cheap. It doesn't cost any money. You can do it anytime. All you got to do is put on some good sneakers and tie them up real tight and go on about your business, all right? So walking is probably the best thing because walking and the motion of walking in your legs, and it helps your baby to also position well in your pelvis, all right? So mama's walking at least 30 minutes a day, every single day, is the goal, okay? Other activities such as swimming and prenatal yoga are also usually safe. So again, consult with your providers first, but those are generally really safe activities to do that are beneficial and efficient for you. The rule of thumb here is you can continue whatever activity you've been doing even before pregnancy. You can continue that activity throughout your pregnancy. But if you have not been doing CrossFit, don't go picking up CrossFit during your pregnancy. Don't make that a new activity because your body's just not used to that type of a level of activity or exercise. So that's usually the rule of thumb. Continue doing what you've been doing and don't pick up anything new or high impact during your pregnancy, okay? So to wrap up our module about maintaining a healthy pregnancy, I just want to tap a little bit into mental and emotional wellness, okay? Mental health is something that we do not talk about a lot in this country, right? There's a whole stigma around depression and mental health disorders. And what we don't talk about a lot either is those disorders during pregnancy, okay? If you are a mama who has battled with depression or sadness in the past and now you're expecting, I encourage you to find a mental health counselor or therapist who you can reach out to when you feel like you need support so that you can feel supported and you can feel like you have an outlet or someone to talk to you through those difficult times, okay? About 10% of women experience depression and anxiety during their pregnancy, and 15 to 20% experience some sort of sadness and depression after pregnancy, okay? So we want to make sure that you have the resources that you need for the times that may be challenging to you, during your pregnancy, okay? Later on, we're going to talk about the importance of a mental health provider during your postpartum phase because hormones fluctuate during pregnancy and after pregnancy and have the ability to enhance any feelings of sadness and depression, okay? So hormones alone put mamas at risk for mental health disorders. So that's something that's very important. We'll dig deeper into that later on, but I wanted to bring that to your attention, all right? So let's wrap up this module. It was lengthy. Let's wrap up and summarize what we talked about, okay? To maintain a healthy pregnancy, we want to make sure that you're making the best choices for food, okay? Making healthy choices and eating a well-balanced diet to prevent different perinatal complications and to grow a healthy baby, all right? Perinatal fitness, we want to make sure you're moving your body during pregnancy. Walking is the best way, the best exercise any pregnant mama can do. And we want to make sure that if you have any mental health, mood disorders, or feelings of anxiety or depression, that you are actively seeking resources to help you and support you through those challenging times, okay? That triad of activities and things to just pay attention to is what will really help you to maintain your healthy pregnancy, okay? This is one book that I do want to shout out to you. It's by Lily Nichols. She's a registered dietitian and nutritionist. She wrote this book and it's amazing. And every mama should have it, okay? So this is one of the books in the book list and library that I'm going to be posting. But I do want you to purchase this book. It has a wealth of knowledge about nutrition, okay, for everyone's diet, all right? So pick this up.